Today I'm going to talk about 10 skin signs that suggest that you may have diabetes or a poorly controlled blood sugar or insulin resistance. 1. Acanthosis nigricans. This can be a skin sign of diabetes, especially type 2 diabetes. It shows up as dark velvety patches of skin, typically in areas like the neck, armpit, or groin. This condition is often linked to insulin resistance, which is a key feature of type 2 diabetes. Studies have shown that people with Acanthosis nigricans are at a much risk of developing diabetes. In fact, one study found those with this skin condition were twice as likely to have diabetes compared to those without it. Acanthosis nigricans is also closely tied to insulin levels and blood sugar, making it a helpful marker of insulin resistance. If you notice these dark patches, it could be an early warning sign that you are at risk for diabetes, especially if you have other risk factors like obesity or a family history of the condition. So recognizing it can be a good reason to check in with a healthcare provider to assess your risk and manage your health moving forward. Number 2, diabetic dermopathy. This is a common skin sign of diabetes. It shows up as a small round or oval patches of the skin, usually reddish brown in color, and is most often found on the shins. It also appears on other areas like the thighs, forearms, or sides of the feet. Sometimes it is called shin spots because of where it typically appears. It's one of the most common skin conditions for people with diabetes, affecting about 50% of those with the disease. Scientists are not exactly sure of what causes diabetic dermopathy, but is thought to be related to poor circulation and damage to the small blood vessels from long-term diabetes. It's more common in older adults and those who have had diabetes for a while. The spots themselves are usually harmless and don't cause itching or pain. Their presence could signal other complications linked to diabetes like neuropathy. Keeping your blood sugar levels in check can help prevent those spots from appearing and reduce other diabetes-related issues. If you notice these spots, it is a good idea to check in with your healthcare provider for proper evaluation and health care. Number 3, blisters. They are known skin signs of diabetes. These blisters tend to appear suddenly and are more common to found on the legs, feet, arms, and hands. They can get pretty big, sometimes up to 6 inches across, and are filled with clear sterile fluids. The good news is that they are usually painless and tend to heal on their own in about 2 to 5 weeks without needing any treatment. The exact cause of these blisters isn't fully understood, but they are common in people with poorly controlled blood sugar levels or those with diabetic neuropathy. Factors like poor circulation and skin irritation or injury might also contribute. The blisters themselves aren't typically a major concern, but they can lead to major infections if not cared for properly. So it's really important for people with diabetes to keep an eye on their skin and reach out for healthcare providers if they notice changes or problems with the blister. Number 4, digital cirrhosis. This is a skin condition that's linked to diabetes. It mostly affects people with a long-term type 1 diabetes and cause the skin on the fingers, hands, and toes to thicken and tighten. The skin can feel stiff, which can make moving the joints of the hands and the fingers more difficult. This condition happens when glucose reacts with protein in the skin, leading to the build-up of substances that reduces the skin's elasticity. As a result, the skin becomes hard and shiny. In the long run, this can make everyday tasks, especially those that require fine motor skills, hard to do because of the joint stiffness. Digital cirrhosis itself isn't harmful, but it can affect someone's quality of life by limiting hand function. Keeping blood sugar levels under control is important in preventing or easing the condition. Treatment might include using moisturizers to soften the skin and help improve flexibility. 5. Xanthomas. This can be a skin sign linked to diabetes. It's characterized by yellowish bumps or patches, usually around the eyelids. These are caused by cholesterol deposits and often point to issues of lipids and metabolism, which is common in people with poorly controlled diabetes. People with diabetes often have abnormal lipid levels, like high cholesterol and triglycerides, which can lead to the development of xanthelasma. Insulin resistance, which is common in type 2 diabetes, can also raise cholesterol levels and contribute to xanthelasma. Both xanthelasma and diabetes are linked to increased risk of heart disease due to similar metabolic problems. It can indicate underlying issues like high cholesterol or poor managed diabetes. So if you notice xanthelasma, it's a good idea to talk to a healthcare professional about checking your cholesterol levels and overall metabolic health. Managing your diabetes with lifestyle changes and medications can help improve cholesterol levels and possibly reduce the risk of xanthelasma and related conditions. 6. Dry and itchy skin. Diabetes can reduce blood flow, especially to the lower legs and feet, which can lead to dryness and itchiness. When blood sugar is high, it can draw moisture from your cells, leaving the skin dehydrated and dry. Diabetes can affect how well you sweat and oil glands work, which can make your skin even drier and more irritated. People with diabetes often notice that their lower legs are the first place to experience dry skin and itching. Keeping blood sugar levels in check is a key to managing this, and using moisturizers and avoiding hot showers can also help to keep your skin hydrated and reduce itching. If the dryness and itching don't go or get worse, it's a good idea to talk to your doctor or healthcare professional, as it could be a sign of other issues or complications related to diabetes. 7. Eruptive xanthomatosis. This can be a skin sign linked to diabetes, especially when there are high triglycerides levels. These are small yellowish bumps, often surrounded by a red ring. They commonly appear on the arms and legs. These bumps can also indicate underlying issues like obesity and insulin resistance, which are common in people with diabetes. It's important to recognize eruptive xanthomatosis because they can signal serious metabolic problems. If you notice these bumps, it's a good idea to get checked out by a doctor to prevent potential complications like pancreatitis or heart disease. Treatment usually involves lowering triglycerides through diet, lifestyle changes, and possibly medication. Number 8. Slow healing wounds. This can be a key sign of diabetes. People with diabetes often have trouble healing wounds. Elevated glucose levels can interfere with the body's ability to heal. When blood sugar is high, it affects circulation and the immune system, making it harder for the body to deliver the nutrients and oxygen needed for healing. Diabetes can cause blood vessels to narrow, reducing blood flow. This makes it tougher for the body to send the necessary healing components to the affected areas. Many people with diabetes develop neuropathy, which reduces feeling in the feet and hands. This means small injuries might go unnoticed, leading to wounds that don't heal properly. And high blood sugar can also impair white blood cells, which are crucial for fighting infections and promoting healing. This increases the risk of infection, making wounds even harder to heal. Slow healing wounds are especially concerning for people with diabetes because it can lead to serious complications like infections and even amputation if not managed. Feet and legs are common areas for this issue. Small cuts or blisters can turn to ulcers if left untreated. You can reduce the risk of slow healing wounds by keeping your blood sugar levels under control through diet, exercise, and medications. Regularly check your skin, especially your feet, and get medical attention right away if a wound isn't healing after a few days. 9. Increased skin infections. People with diabetes are more prone to various skin infections. Consistently high blood sugar can weaken the immune system, making it harder for the body to fight off infections. High glucose levels also create a perfect environment for bacteria and fungi to grow. Diabetes can cause blood vessels to narrow, reducing the blood flow, especially to the hands and feet. This makes it harder to heal from infections and increases the risk of developing them in the first place. Many people with diabetes experience nerve damage, which can numb the skin, making it easy to overlook small cuts or irritations that can lead to infections. Diabetes can cause skin to become dry and cracked, creating opening for bacteria and fungi to enter and cause infection. Common infections to watch out for may include bacterial infections such as boils or cellulites, and fungi infections including candida infection, especially in moist areas of the body, and ringworm, which affects the skin, hair, and nails. If not treated properly, these skin infections can lead to serious complications. Timely medical treatment like antibiotic or antifungal medications is often necessary, and managing blood sugar levels is key to preventing these infections in the first place. And the last sign is skin tags. Number 10, skin tags. This can sometimes be a sign of diabetes, especially in people with insulin resistance. Research shows that there is a strong link between multiple skin tags and insulin resistance, a key feature of type 2 diabetes. People with higher insulin resistance are more likely to develop skin tags, especially if they have 5 or more in areas like the neck or armpit. They are quite common in people with diabetes and tend to appear in clusters, and are more common in those who are overweight or have a metabolic syndrome, which are both risk factors for diabetes. Skin tags can also be linked to other conditions like obesity, high cholesterol, which are often seen in people with diabetes and can complicate the overall metabolic profile. Having a few skin tags isn't usually a cause for concern, but if you notice several appearing, it could be a sign of underlying issues like diabetes. If you have an increase in skin tags along with other symptoms of diabetes like increased thirst, frequent urination, or slow healing wounds, it's a good idea to see a doctor for evaluation. Skin tags on their own don't diagnose diabetes. However, if you start noticing more of them, especially in clusters, it could indicate insulin resistance, and it could be a sign to get checked for diabetes. So these are the 10 skin signs that indicate diabetes. Now, reversing diabetes is all about making changes to your lifestyle, especially with what you eat. By choosing real whole foods like low carb vegetables, healthy fats, and protein, your body can start to adjust and reduce insulin resistance. The key is to start taking actions before things get worse, not after your health gets worse and begins to break down. To get started, check your blood markers. When you get a blood test, don't just look at the reference range. Understand the numbers. For example, if you want your hemoglobin A1C to be under 5.3, anything higher, that is especially 5.7 and above, could mean you are slipping into prediabetes. Keep your fasting insulin under 5, ideally lower if you are insulin sensitive, and keep an eye on triglycerides. Under 100 is great, especially for those on a low carb or keto diet. When it comes to reversing type 2 diabetes, it's entirely possible with the right approach. This involves changing your eating habits. You can try different approaches like the paleo diet, which focuses on real foods and eliminates sugar, processed foods, and grains. If you are more insulin resistant, you might want to go lower carb and higher fat. A keto diet takes it a step further by cutting carbs to less than 5% of your calories, putting you in ketosis. Some people go even lower carbs with carnivore diet, which cuts out all carbs and focuses on just meat. This can be beneficial not only for insulin resistance, but also for addressing potential allergies. You don't have to wait until diabetes gets worse. By making small but important changes now, you can reverse or prevent type 2 diabetes and improve your health for the long term. And let me remind you, I am not a doctor or a dietitian. This information is for educational purposes only. Consult with your doctor or dietitian before making any significant changes to your diet. And thanks so much for staying with me till the end of the video. If this information was valuable to you, hit the like button and do well to subscribe. See you in the next one. Bye.